News 5 investigators have discovered you are waiting longer and longer in local emergency rooms, and it gets even worse for those suffering with mental health issues.
News 5 investigator Jonathan Walsh joining us now. And Jonathan, the data is eye-opening.
Absolutely, and you're about to hear all of the hospitals we looked at in our area have something in common. And it's not good news if you are in a mental health crisis.
When Mark Colella was just 20 years old, it began.
You start thinking you're somebody else, or you think the CIA is after you.
He found himself experiencing manic episodes with delusions of grandeur, strange, intense energy, and racing thoughts.
There's no societal brakes on what you're doing. You're just kind of doing whatever you feel like doing in the moment.
One time, back in the mid-1990s, Mark tells us he hopped the fence at the ballpark here in downtown Cleveland, even ran the bases just because he wanted to do it, and all while having a manic episode.
Luckily, most of the police officers have always taken me to the hospital and not to jail.
Lucky, but not so lucky, because he says when he got into an ER, sometimes staff would lock him in a room.
I started taking my bed on wheels and I rammed it against the door several times until the door opened up.
Here's a picture of one ER visit. He smiled for the photo, but he says in reality, he was hallucinating, seeing demons. But even with that, he tells us he waited 72 hours in the ER before getting treatment.
They couldn't find a bed for me. They were going to send me to Columbus, I think, at one point.
So many emergency rooms in Northeast Ohio are having these kinds of problems. When patients went to the ER for physical problems, from check-in to leaving the ER, the longest wait we found was 4 hours, 15 minutes. But for mental health issues, in the top 5 longest wait times, it's 8 to 9 hours at UH facilities, even nearly 15 hours at Altman Hospital in Canton.
The longer we wait, the potential we run for things to feel a little worse and symptoms to get worse.
Angela North is with Geauga County's National Alliance on Mental Illness, or NAMI. She says part of the problem is the way even health professionals still view psychiatric patients.
Those living with mental illness aren't scary. They're not bad people. Just like anyone else, they have a condition, and there are symptoms to that condition.
As we dug further into the data, we found every hospital we looked at had longer wait times for psychiatric patients than those with physical issues. Sometimes 3, 4, 5 hours or more on average of waiting.
We do have a deficit in staffing all across the nation.
The resources needed in the community are unlikely available.
Dr. Robert Tressman,
and so they end up languishing in an emergency room,
is from the American Psychiatric Association. He says nationally, there aren't many mental health professionals in ER departments.
All too often, the emergency medicine doctors are obligated to try to provide care, and they frequently don't feel comfortable doing it, nor are they appropriately trained and skilled in it.
He says solutions to this problem could include additional funding for more staffing and more space for psychiatric treatment. Angela agrees and suggests Ohio hospitals adopt what some in Arizona and Florida are doing.
We have specified doors that people can go in, specified facilities that people can go into to have that emergency care right then, right there, limited wait, if at all.
Mark now works with NAMI Geauga County as a group facilitator and is a co-host to a podcast promoting mental health support and care.
I can't necessarily stop it on my own, but I can sort of navigate my way out of it if I steer into it and accept it.
He says just having a person to sit with psychiatric patients in the ER could go a long way. That, he says, would have helped him when he was banging his bed into doors, begging for someone to listen.
The whole thing there was nobody was communicating with me. And I think that's the key in this situation when you're in the ER.
Now, Altman Hospital says it doesn't have inpatient care for mental health patients, and it's experiencing delays in transferring patients because of a shortage of available beds and facilities. Now, UH says it's seen a surge in demand for emergency services dating all the way back to the pandemic. We have full statements from UH and Altman, plus a list of the longest ER wait times in Northeast Ohio for psychiatric patients. That's all on our News 5 app.